Hello, my name is Luisa Andreu, and this is going to be the final presentation for my class, Public Affairs 125. The topic of my presentation is going to be the need of mental health days in school for California students. I hope you enjoy my presentation and learn from it. Some of the goals of this presentation are to show the necessity for the California State Legislature to get an understanding of the mental health crisis that currently exists in their state. In addition, the presentation is going to show the need for the California State Legislature to pass Senate Bill 849. This bill would allow students in K-12 to treat their mental health needs. Lastly, this presentation has an overall theme of showing the importance of mental health and why it cannot be ignored. If we take a look at the data, we can see that UCLA Classroom published a study showing that nearly half of California adolescents report having mental health difficulties. Continuing on, 45% of California youth between the ages of 12 to 17 reported having mental health difficulties, with nearly a third reporting serious psychological distress. Lastly, in 2019, America's Health Rankings reported that suicide is the second leading cause of death for the age group of 15-24. In the chart, we can see that this number continues to increase. In 2020, the ACLU of California conducted a survey to 650 students in California. They were asked to rank their mental wellness from 1 to 10. As we can see, 65% of students gave themselves a 7 or higher, but the recent study dropped to 40%, with 23% of students ranking their mental wellness a 3 or lower. I have included the image of Kamala Harris to show the importance of policymakers in the state of California. In this image, she is teaching students about health and mental wellness. This chart below shows the amount of patients that California emergency rooms had in the years 2012 to 2018 based on mental health. As we can see, this is a problem that occurs and has been occurring for years. And though we don't see the years of 2019 to 2021, we can imagine similar patterns to be happening. This shows the severity of California in terms of mental health and why it cannot be ignored. A state that has made advances in terms of protecting mental health for their students is Utah. In the summer of 2018, the state allowed an increase of allowable illnesses for school absences. This included mental health. This is an incredible step of students being protected by their states. And not only is Utah an example for other states, but it is setting records in terms of what it means to care for your students. Another state that has made incredible progress in terms of mental health awareness is Oregon. In the summer of 2019, it passed a law which allows students to call in sick from school with mental health being an excusable absence. In addition, the state gives their students 5 mental health days in a 3-month period. This is exactly what California should pass, as it gives students the ability to take care of their own mental wellness. In addition, this teaches students that having a break is perfectly okay. There are many still against the idea of mental health days for students. Some of the main reasons why people are opposed include the opportunity of students taking advantage of the policy, the fact that there is no true definition of what is allowed for mental health days, and, perhaps more important, the fact that mental health is still not seen as important as physical health. Due to stigmatization and seeing mental health as not as important, we can see why many are opposed to Senate Bill 849. I have included this image to show why many are opposed to Senate Bill 849. By believing that students will do nothing with their day if this passes, many believe that this bill is not a good idea. However, this is simply not the case, and it is an incorrect idea of what mental health is. The stigmatization of mental health has led to this incorrect perspective of what mental health actually is. Though it is impossible to describe every benefit of the bill, it is important to note that it would be a start to decreasing the mental health crisis in the state of California. In addition, it will teach students that it is okay to ask for help and that their mental wellness comes before school or work. In a society where mental health is not discussed, this bill would allow students to do what is best for themselves. As the data presented shows, mental health is an issue that cannot be taken lightly. If the bill is not passed, students will continue to believe that their mental health struggles are not important and that policymakers do not care about them. Jennifer Rothman, who works at the National Alliance on Mental Health, shared that this bill is a great start to solving the mental health epidemic that currently exists nationwide. There is no one true way of dealing with mental health. Some of the ways that mental health days can be used by students include taking the day to do homework, attending a counseling session, doing exercise, and practicing yoga. Like I said, there's no one way of improving one's mental wellness. However, this bill would allow students to do what is best for each self. Many wonder why students should be able to miss school for their mental health when schools can provide the resources. However, it is important to consider that at times, schools have hundreds of students, and that not everyone can get the personalized attention that they need. In addition, for many, what constitutes a mental health day is being away from an academic setting, and this could not be accomplished through school. In terms of policy recommendations, it is crucial for the Senate Bill 849 to pass. It is also important for schools to continue growing their resources, such as by creating programs for those most prone to mental health illnesses, such as people of color and LGBTQ students. Lastly, schools should work together with parents and guardians so that students, parents can understand the importance of caring for their student. Here is the list of the sources that I used for my presentation. Thank you so much for listening, and I hope you took away the importance of mental health in the state of California. Have a great day.